Hey you guys. All right. So yesterday we covered hypo and hyperthyroidism and we talked about what it is and the treatments. I just want to briefly hit on those treatments, the drug interactions, and the contraindication of those. So remembering with hypothyroidism, we treat with Synthroid, right? Levothyroxine. Key things you want to tell them is take on an empty stomach for absorption purposes. And also, once you initiate it, you want to make sure that you monitor that TSH level in 6 to 8 weeks. Once it's within a therapeutic range, you can start to monitor that TSH every 4 months. And if you're consistently with a good dosage range for that patient, you can put them on an annual monitoring schedule. Now, the drug interactions that you want to consider because of absorption is your calcium carbonate, your Lasix, yes, furosemide, and also food items like grapefruit, papaya, as well as those soybean products, okay? All of these can alter their absorption. So make sure you're letting your patients know this so that you are eliminating those in their diet, okay? And then as far as contraindications for Synthroid, uh, patients with any active cardiac issues like active cardiac arrhythmias, if they acute MIs, of course, if they have hyperthyroidism, you don't want to give it, or thyroid toxicosis, and also those with chronic adrenal insufficiency. Okay, I recommend making like flashcard sheets for these to help you. And what I mean by that is just a big sheet of paper, writing out those questions just like you would a flashcard. Put the answers on the back and hang them around frequent areas of your house so that it's forcing you to study stuff like this, okay? Don't make pharmacology a separate system to study. Just add it on as you're studying the topic, the system, like so how we're doing this. Study it along with it. Don't give yourself something additional. Go ahead, because when you separate it, then you have to link them together, which is just giving you an additional task to do, right? All right. So hyperthyroidism, we can treat with those antithyroid medications like PTU, Tapazole. You also have your radioactive iodine in your surgery, but I really want to focus in on those antithyroid meds. So with those, they're utilized to inhibit the production of the thyroid hormone because we are in excess, right, with hyperthyroidism. So PTU, medicines like Tapazole, those antithyroid meds, they don't have many contraindications unless they had like hypersensitivity to it previously. But like Tapazole, you really want to be cautious with giving that to the pregnant women. If you have to give PTU to those pregnant patients, make sure that they are being monitored very, very closely. But a few drug interactions I want to make you aware of. You don't want to give oral anticoags if at all possible. So if they're on the Coumadin, be careful because it affects the activity of the vitamin K. And then also be cognizant of those beta blockers, the digoxin, the theophylline, because it affects the clearance of those medicines. So you may need to adjust the dosages and decrease them if the patient has hyperthyroidism and you are treating them with the antithyroid medication. Okay? All right. That's all for today. Short and sweet. I hope you found it helpful. Like, comment, subscribe, and meet me back here. Bye, y'all.